Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAX. Thank you for joining me in my latest demonstration video of our soon to be launched WAXscope. We're hoping to launch mid-March now, so just a few weeks away. In fact, the WAXscope is ready. I'm just preparing all the supporting training material. So when we launch, we want to make sure it's at the very high standards, both the practical and theoretical training. So I'm just busy away most evenings and weekends at the moment, focusing on that. Now, this is of a patient who is a young child, 7 years of age, and they had the most incredible amount of earwax and dead skin, keratin in their right ear. So this has been becoming slowly more problematic over recent weeks. They visited their doctor who advised to use drops, but the symptoms just exacerbated. You can see a thick layer of keratin there, the white superficial layer that's enveloping that wax plug. And after I removed that plug there, I thought that was it, but there was still mountains of wax and skin here. And bless the patient, she was crying even upon entering the room. She was extremely nervous and anxious, and we played a little game with her with the equipment I'm using, so the suction tube. So with children, I always first of all trying to acclimatize them to what it's going to feel like. So I get them to put their hand out, and I just place the suction probe onto their onto their palm, the thick part of their palm, just below your thumb, just so they can feel that suction. I then put it on their cheek and on their earlobe, and then I acclimatize the child in terms of the noise. So I hold it beside the ear, and I then get them to have a go. So I get some tissue, put it on my palm, and I get them to hold the suction probe, and I get them to vacuum the tissue, and we then have a joke. I always ask them if they've done this before, because they're so good. And then I start moving my hands and ask them to do it again. And obviously it's going to be a lot more difficult. So I explain to the child, if they stay really, really still, it's going to be easier. But if they move a lot, then as they can themselves experience, it's going to be difficult because it's a moving target. And this patient, most children are really, really still. At that stage, they've calmed down. And we've had some children that through no fault of their own, they're just too anxious and nervous, and they continue to cry. And this patient did for the first part, until I removed that big plug. They could definitely feel this plug in the ear, and it was a big relief when I removed it. So I'm using our smaller speculum size here, and it worked really, really well. Obviously, being a young child, I've got a very narrow ear canal, so I've just dosed this ear with more olive oil spray. I've removed quite a sizable piece of wax and keratin already, and the WAXscope works so well with this patient, and I think it's definitely a tool that is more advantageous for children who, again, are no fault of their own, they're not able to stay as still as most adults. And because you've got the speculum, it just dilates, straightens the ear, and it just makes everything nice and still and steady. When you've got an endoscope, which still for me there's no better method of visualization, I believe, for earwax removal anyway, than an endoscope. There is no speculum, so you're using the endoscope, the side of the endoscope, to dilate and straighten the ear. And when you've got a patient who's moving quite a lot, it can be tricky to do that. So the WAXscope just makes that process a bit easier. And we're just working around the sides of the canal wall. I'm teasing this away. So this was attached to the eardrum. You'll see some skin adhesions at the end when we visualize the eardrum. So the eardrum was slightly inflamed, vascularis, but there's no glue in, no fluid behind the eardrum. I assessed that. I performed a pressure test called tympanometry, where we measured the mobility of the eardrum, and they had good mobility. So they may have a bit of acute otitis media, so some inflammation of the middle ear. I'm assuming, though, it's just this impaction up against the eardrum. They did also have a wax impaction in the left side, so you will see that as part of this video. And a bit less wax, but in that ear they had a blocked eustachian tube. They had negative middle ear pressure. You can visibly see the eardrum retracted in the attic. So the attic is the top part of the eardrum. Or the term we should be really using is pars flaccida. So there's a boundary, a border in your eardrum where the pars tensor, which is the more taut portion of the eardrum that responds to sound waves, so it vibrates because it's really stretched, that part of the eardrum, and sound waves hit the pars tensor, it causes the pars tensor to vibrate. The pars flaccida is a bit different. It's more elastic. It's thicker, but it's not as stretched, so it's more of a pressure shock absorber, really, because the middle layer of the pars flaccida, the fibrous stratum, which is made up of fibrous connective collagen tissue, in the pars flaccida, it's more elastic connective tissue, and it isn't arranged in the same manner as the fibrous stratums, the middle layer of the eardrum, in the pars tensor. In the pars tensor, for the majority of the pars tensor, I should add, this fibrous connective tissue is really well organized and arranged. So you've got three arrangements. You've got the concentric arrangement, so this fibrous tissue goes around in circles outwards to the periphery of the eardrum. So it starts off at the middle, at the umbo, center of the eardrum, and it spirals outwards. Then you've got these radial fibers which extend from the center of the eardrum, the umbo, outwards, and that gives that middle layer of the eardrum a spider's web appearance. Then in addition, you've got parabolic arrangement of fibrous connective collagen tissue, which is a very oblique circles. So they give you an added layer. Now, the posterior superior part, so the back north part of the pars tensor, however, is more arranged in terms of the middle layer of the eardrum, the fibrous stratum, as the pars flaccida. So it's not as stretched as the rest of the pars tensor. It's more elastic, and that region of the eardrum in particular is prone to getting retracted, sucked in. So this is the right eardrum. It's going to get it in focus. You can see it's quite red, but you can see all those blood vessels there supplying the umbo. Bit of keratin, residual keratin on the eardrum. We're going to leave that. We're not. A poor child's already upset. So you can see some keratin that's attached to the eardrum. It's a bit red, so I suspect that's just vascularis, so dilation of the blood vessels, because we've removed this, we've detached this from their eardrum now. The patient's parents advise that this patient does suffer from dry skin, so maybe some eczema or dermatitis, which then leads to a higher turnover of skin. So when you've got eczema or psoriasis, you've got inflammation of the epithelial skin, which then produces more skin cells, and the more skin cells you produce, the more skin cells that are going to die and shed. This collects in the ear can't expel them quick enough, so it builds up into a plug. So that could be a plausible reason as to why this patient is getting this build-up. So this is their left side, so it came away far easier, it wasn't as impacted. The eardrum's got a more translucent appearance, so it's more see-through. So you can definitely see the difference in colour between the two eardrums, but this eardrum is retracted, so we confirmed that using the pressure test, which means there's negative middle ear pressure, and that's as a result of an obstructed eustachian tube, which is the pressure equalizing tube connecting the middle ear, so the cavity behind the eardrum, to the back of the nose, the nasopharynx, and when that's blocked, there's no air in the middle ear. So that's the eardrum. You can see that eardrum. You can see the stretched part, the top part. You can see all that. That eardrum's like a piece of cling film that's wrapped around that hammer bone. But you can see all that fine detail. It's just amazing, the fine detail we're getting with the WAXscope. This is all the wax and skin from both sides. It's a tremendous amount for a young child. And she was really, really happy, and gave me a big thank you and a high five at the end. So hopefully they've had a good experience, and it won't stop them coming in the future if they have similar problems. Take care, guys. Bye.